Welcome to AARP Illinois' virtual event. It's so wonderful to have you with us. AARP is on a mission to connect with individuals across various communities, especially those aged 50 and above. We're here to listen, understand, and address the unique needs of you and your community as we age. Our goal is to enrich your experience by expanding our local activities, providing opportunities for you to discover and engage with all that life has to offer right here in your own community and virtually. As we journey through today's event, we invite you to consider joining our dedicated team of AARP volunteers. It's a chance to make a meaningful impact and help us better serve those 50 plus across the nation. Connect with us and be a part of this vibrant movement toward positive change. Welcome. And let's make this event both fun and transformative.
Good morning, everyone. Welcome to Health Huddles with AARP Illinois. I'm Courtney Hederman, the Senior Associate State Director for AARP Illinois, and we're thrilled to have you all join us. Today, we're going to delve into a very important topic, and it's the importance of maintaining healthy teeth and gums as we age. Dental well-being isn't just about a bright smile. It directly impacts our overall health and quality of life. So we're going to explore practical tips, common challenges, and really ways to promote our oral health. I cannot wait for this. This is a really wonderful topic that I'm very interested in, so I can't wait to hear more. So to shed light on this important topic, we have a very esteemed guest with us today, and I'm so excited to be talking with her, Dr. Mona Van Kanigan, who is the Oral Health Chief for the Division of Community Health and Prevention at the Illinois Department of Public Health. So, Dr. Mona, thank you for being here.
Oh, I'm so excited, and I'm so thankful for this invitation, Courtney.
Oh, thank you so much. I cannot wait to hear and have this discussion with you. Okay, so let's just jump in. But before we do, I'd like to remind our Facebook and YouTube viewers, if you'd like to ask questions, have any comments, please share them in your social media feed. So put those in the chat, in our chat there. We'll do our best to address any questions and any comments that you have during our conversation. So please don't forget to do that. Okay, so let's just kick some things off with some questions, and we'll add questions as we get them. So yeah, Dr. Mona. So obviously, dental health, I think you could overall say is important, right? But like, really, why is dental health important, especially for anybody who is aging, right? We're all aging, but like, why is that important for older adults overall?
Right. So there are just significant age-related physiological changes as we age that puts us at increased risk for oral diseases and issues. And some of the most common ones, I think the audience know about: tooth decay, which is a bacterial infection; periodontal disease, again, another bacterial infection. And both of these can get worse as we age, because as we age again, dry mouth is something that also occurs or can occur. And when you have dry mouth, it makes those two things, the dental caries and periodontal disease, even worse. And the dry mouth is actually caused by reduced function of the salivary glands as we age, and then of course side effect of medications. If I may, I want to just talk a little bit about periodontal disease. That's really important for controlling and treating that early is really important for older adults and adults in general, because it is a chronic inflammatory condition. And I think we're learning more and more about how inflammation, whether local or systemic, can really affect a lot of other health conditions. So there's growing evidence suggesting a link between periodontal disease specifically and cardiovascular disease, diabetes, rheumatoid arthritis, Alzheimer's disease, and a bunch of other chronic illnesses.
Wow. Okay. So to say that obviously our dental health isn't important would be an understatement, right? Because it has so many correlations. Now, you talked about some of the common dental, you talked a little bit about some of the dental issues, but like, what are kind of like the most common? What would someone likely experience just really because maybe we're aging?
Yeah. So, tooth decay. So maybe as a younger adult or a child, you had, cavities that were filled, controlled. But as we age and with a dry mouth and maybe even changes in what you're able to eat or what you're eating, that previously treated tooth decay can what we call reoccur, you know. Again, most common diseases for older adults are the same: tooth decay or dental caries, periodontal disease, which is also, again, known as gum disease. Both of these can lead to eventual tooth loss. And that, again, has other implications on what you can eat and what you can chew. And, but even though tooth decay and periodontal disease are very common, they're almost completely preventable. The other thing I think that adults need to be aware of is oral cancers may be also of increased concern for older adults.
Sure, that makes sense. So like, so when you're talking about, perhaps prevention, right? Because there's got to be some prevention tips, right?
Yes.
So how does someone, think about it in those terms? And really, I would assume part of it is like good, gentle hygiene, right? So what are the tips and whatnot for good, gentle hygiene?
Yeah, so the basics are remain true across age groups. So brushing for 2 minutes twice a day and flossing at least once per day is the recommendation, right? It's more important to really spend the time to do this effectively, taking the full 2 minutes to make sure that you're reaching all areas of the mouth in between the teeth with the flossing aids. And you can use other things, not just a regular old toothbrush, but you can use electric toothbrush, flossers, water picks, and other kind of innovations and items can make doing the brushing and flossing much easier. When you're brushing, angle that toothbrush where the gum and the tooth meet, as well as brushing the chewing surfaces of the teeth. As I always say, it's always more important to spend the time to do these actions effectively, even if it means doing it only once per day. Good, consistent, effective oral health practices can prevent the common dental issues we talked about. However, it takes daily action as well as a healthy diet of low sugar, food and beverages, drinking fluoridated water, really important, even after our teeth have developed, increasing protective behaviors, such as limiting alcohol, tobacco use, being mindful of sun exposure, and then, of course, regular professional assessment to catch or to diagnose and treat conditions early.
Yep, that makes sense. Now, I remember, I'm somebody who is very, I always go to the dentist, regularly, brush my teeth multiple times a day, all of those things. I remember so I had 3 pregnancies basically back to back to back. And I got a cavity after my last pregnancy. Like I'd gone in like regular checkup, cause I'm like every 4 months. And I was shocked that I had a cavity. I was, in my late 30s at the time. And I'm like, I brush my teeth all the time. How is this possible? And my dentist was like, yeah, it's probably because you just, you've been pregnant for 3 times, like right in a row. Like it is very possible that your just body couldn't help it. Even if you do all of these things, sometimes it happens. And so I'm just curious what you think about, I guess, that assessment. Is that kind of true? Like you can do all these preventative things and sometimes it just happens. It's just what your body does.
Right. I mean, the dental cavity that you got, is a bacterial infection. So what are some things that could have happened throughout those pregnancies that impacted maybe the amount and the level of bacteria that was present that basically dissolved the tooth structure. Stress has
Yep.
impact on saliva, right? Saliva flow. So when saliva actually has really healing properties, it has calcium in it, so it can remineralize teeth, especially a very early cavity. So it could be stress, nutrition. Maybe you were with those young babies. Maybe you were,
I
maybe
was
you were
stressed.
brushing. Yeah, maybe you're brushing and flossing, but
Yeah, yeah, yeah.
maybe not
That's
in
fair.
the angling the toothbrush, or
Yeah, no,
you know what I
it's
mean?
yeah,
Or
for
maybe
sure.
you were having to have quick meals that were like high carb rich and soft,
Yeah.
and those kinds of things. So, yeah, again, it's a those these conditions, oral conditions, occur across the lifespan, right, at all
Yeah.
ages,
Yeah.
and that's why that consistent behavior, paying attention, doing it at the most effective way possible is really, really important. And then, of course, since you were getting regular care,
Mhm.
it was detected early and
Right,
treated
for sure.
early. So that is also really important.
Yeah, no, that's great. Thank you for that.
Yes.
So we do have a Facebook question.
Okay.
So it's the question is it correct that cavities are that cavities are created from sugar and other non-plant foods, and that fruits necessarily don't really contribute to cavities?
Yeah. So good question. So dental cavities are caused by a bacterial infection. So anything that is food for bacteria to grow and produce and reproduce could potentially cause a cavity. It's a very specific bacteria that you have to have in your mouth for the cavity, for the bacteria to overgrow, and I guess their products are basically acidic, and those acids slowly take the mineral out of the tooth structure, causing a hole, which then, packs with food, and you're not able to keep it clean, and then over time expands if you don't get it treated. So, anything that could be a food source for bacteria could cause a cavity. So it could be fruit sugar, could be simple sugar, it could be, your Coca-Colas and things like
Mhm.
that. It could be, just food that you eat that's carb rich, that again is food source for the bacteria for them to reproduce and then basically secrete the acid, which then takes the mineral out of the tooth. So yeah, any kind that has a sugar food for bacteria could cause a cavity if you have that bacteria in the mouth. Mhm.
So interesting. I had no idea it was that complicated. Not that it's complicated, but kind of. I had no idea that it was that way. So wow,
Yeah,
this is
it's
really
just
interesting.
bacterial infection.
Yeah.
Yeah, definitely. That's
Wow.
why
So
it's so
interesting.
important to physically remove the bacteria. Yep.
Yeah, right. That completely makes sense. Well, so you're this actually is a perfect segue in the sense of kind of this part of the question. Like, okay, so we do know that obviously some foods are going to
Mhm.
result in well more practicality of okay, you have to get rid of that, right? So you're not necessarily going into cavities and other types of issues. So obviously nutrition does play a pretty
Yes.
big role, more than I even actually thought. So maybe talk about the how not only just like what the role that nutrition plays, but like so what are the foods that we should probably be really eating that
Yes.
promotes healthy teeth and gums too then?
Right. So, any food that you eat that has kind of, when you're chewing, has an
Mhm.
effect that removes food particles that might be stuck in or on teeth is good. So, like apples, chewing apples, cheddar cheese actually has what we call an anti-cariogenic effect. So those are a couple things and then of course, fluoridated water, drinking that rinses your mouth out of maybe food that might have been, stuck in teeth or between teeth. We already talked about brushing and flossing, so that's covered. But healthy diet affects the teeth and oral tissues, and of course, saliva as I mentioned, saliva has very healing properties. But when your health of your mouth is not adequate or optimal, it actually affects what a person is able to eat. So this is really especially true with gum disease or when you have lost teeth because it's just harder to eat certain nutritious foods, right? We want to be able to eat a variety of nutrient-rich foods from across the food groups that can promote healthy teeth and gums. So a balanced diet includes fruits, vegetables, proteins, grains, dairy, that are all important in maintaining oral health. So calcium and protein-rich foods, such as low-fat milk, cottage cheese, yogurt, salmon, lean meats, all promote strong teeth and bones. And then I want to highlight, especially vitamin C really promotes gum health and healing in the mouth. Common sources are, citrus fruits, tomatoes, peppers, spinach, potatoes. Vitamin C has a really interesting, effect on gum health and promotes healing in case you get a little sore or a cut in the mouth. So those are some of the things that I would highlight as foods that can promote health of teeth and gums, as well as some of those have an anti-cariogenic effect.
Yeah, awesome. These are great tips and great things. Thank you so much. This is wonderful. So we have another question. I think it's kind of a little bit more of a comment from Facebook. This person indicates that they just had all of their teeth removed because of crowns kept breaking off. The person has lymphoma and dry mouth. It's very difficult to brush, eat, or chew and speak. And the person had cleanings every 3 months and used charcoal toothpaste. So any advice you might have for that type of person who is experiencing obviously lots of different challenges?
Right. Dry mouth just makes everything just so uncomfortable, right? That saliva, having adequate saliva just really moisturizes, as I said, heals, early cavities and heals gums and the gum tissue as well. So anything that you could do to increase your saliva would be a good thing. So if that person is taking other medications that might contribute to dry mouth, talk with their medical care provider to determine if there's an alternate medication that could be considered. The other thing is that you could try, of course, drink plenty of water, right? You could also use sugar-free lozenges that might also increase the saliva secretion. Limit use of mouthwashes that might have alcohol in it. And of course, other beverages that have a drying effect, which includes like alcohol, caffeinated beverages, that kind of thing. And then I think the person said that they had all their teeth removed, correct?
Right. Yes, it does say that. Yes.
So definitely having periodic oral exam to make sure that you're not getting other infections, such as like a fungal infection or something like that because of their, immune status and as a result of the other medical care that they're getting.
Great advice. Great advice. Thank you so much. We do have another question. Is neem powder good for the prevention of bacteria? I'm not sure what that is, but.
Yeah, I'm going to have to get back with you on that. I don't know the research on that. I know people have used it in other, not generally in the US, but I think in Asian or Eastern Asian countries. I'm going to have to get back with you. Maybe I can send what I find to you, Courtney, that you could share.
Sure, of course, absolutely. So stay tuned on that one, everybody. Perfect. So, obviously we talked a lot about, I think, you actually said, a lot about dry mouth and stuff like that. Is there anything else you think you want to add to that? Just because it just seems like that could be a significant challenge that people experience, and just want to make sure we're really diving into that one.
Sure. So again, seeing if there's an alternate medication that could be considered, sugar-free lozenges. Lots of times,
Love that.
lemon lozenges could help. There are products that could help also. There's a Biotine has mouthwashes and actual like saliva substitutes that you could put on your tongue and then just kind of cover it all over your mouth. And that's especially helpful right before eating. Making sure that your humidity in the place where you sleep is also adequate. So you might want to consider like examining how much of the area has humidity, or maybe even bringing in a humidifier or plants that could add to the humidity in the air. Those are all, things that could help dry mouth. Yeah.
Oh, I love it. Those are great tips too. Perfect. Well, so sometimes we can do all that we can, and ultimately we might have, teeth that need to be removed, that there are teeth that just fall out. I mean, there's lots of reasons, right? Where, someone does not have their full set of teeth. And so,
Right.
Can you talk a little bit about that? And particularly, obviously, sometimes people go towards getting dentures or implants and replacing those kind of missing teeth. And so, what should people know about that?
Yeah. So dentures, either full or partial, or implants are, really helpful to people, especially as they're trying to, maintain their nutrition and quality of life, right? The thing with dentures is that, we as dental providers try to have open and honest conversations around expectations and really realistic outcomes that can be had with dentures. Denture studies have shown that on average, full dentures only provide about 25% of chewing efficiency compared to one's own natural teeth. Okay. And then dry mouth, also, and maybe even neuromuscular conditions and a person's outlook, like, am I going to do well with this? Or is this, because it is not part of your body, right? The denture is something that you put on your gums, right? So those things might have an effect on the ability to wear dentures or adapt to dentures. Okay. Dentures need to be taken out daily, brushed and rinsed. Sometimes people don't remember that or don't do that. And that has a cause. When you keep your dentures on your teeth, on the supporting bone, can cause gum shrinkage and loss of the supporting bone, which then can cause dentures to fit improperly, leading to pain, trouble eating, and infection. So lots of issues and considerations when you're talking about dentures, and things that people need to know on the front end. Have a different attitude, understand the expectations and the realistic outcomes that can be had with partial or full dentures.
Makes sense.
Of course. Yeah. And dentures need to be checked regularly, at least once a year for fit and function. And then also professionally clean, to make sure that, there's no fungal organisms that are causing, infection or irritation on the tissues that the denture sits on top of. With regards to implants, there have been major advances in implant technology. And there are many, many dental practices that are implementing and placing implants. The process is faster and even more successful, improving quality of life for many adults, but unfortunately, implant procedures remain costly.
Yeah.
And therefore they still seem to be out of reach for many people, but definitely a better option if you have the resources.
Sure, that makes sense. Thank you for all of that. I just learned a lot of new stuff.
Courtney, let me add one more thing
please.
about implants. In Illinois, we have 3 dental schools.
Okay.
And the dental schools, they're teaching institutions. And one of the things that they do teach is implantology.
Mhm.
So you might maybe our audience, if they're interested in understanding or learning more about accessing implants, you might want to go to the three schools, maybe the websites of those to figure out, is that a source of care that might be a little less costly for individuals. And the three schools are SIU School of Medicine,
It's Southern Illinois University, right? Yep.
Yes,
Mhm.
yes. University of Illinois at Chicago, College of Dentistry, and Midwestern University's College of Dental Medicine Institute in
Perfect.
Downers
Thank
Grove.
you. That's awesome. These are really great. Okay, so we have another question as it relates actually to mouthwashes that you made reference to. So it says, although there are alcohol-free mouthwashes, lots of mouthwashes do have alcohol in them. So is there a benefit with the alcohol added?
Well, I know the Listerine product, that's the one that I'm
Yeah.
familiar with, that does not have alcohol, still has a therapeutic effect. So, yeah, the alcohol itself has an effect, but mouthwashes that do not have alcohol also have, a therapeutic effect with gingivitis, especially. So, yes, alcohol-free mouthwash are effective.
So those are kind of the better of the two. It's like a non-alcohol one versus an alcohol one.
For dry mouth, yes.
Okay.
And you do have to look at the packaging, because there are non-alcoholic mouthwashes that are not shown to be effective. The one that I know that is effective is Listerine by brand.
Okay.
But
Awesome.
you can look at the packaging to
Mhm.
look for the ADA seal and some of the other statements that it will have that will tell you if it's effective against gingivitis or not.
Awesome. Thank you. That's the great tip. We have another question as it relates. What can be done to prevent or treat receding gums?
Right. So first of all, making sure that, receding gums is a result of periodontal disease. So making sure that the periodontal disease has been treated and is no longer active. And once that has been treated, additional surgical services might be indicated, and really need to speak with a periodontist, which is a specialist in the periodontal diseases and supporting bone. We can utilize other medications that are put in between the gum and the tooth in that sulcus. That's what we call the periodontal sulcus, as well as reflecting the gum tissue back, putting in bone, and then putting the tissue back, and then the healing could allow for additional bone that could then support the gum tissue that was that had receded. But again, this is a specialized procedure, and your consultation with a periodontist is indicated.
So can you actually prevent receding gums? Is outside of, I mean, yes, your regular checkups and the things you've already talked about is how you basically prevent it. But is there things that you could do and it just still might happen?
I think the aging process in general, has has the ability to cause recession of gums, but basically the recession of gum is because the gum is sitting on top of bone, which when over time little bits of it get taken away, the gum, because it's sitting on bone, will recede, right? So
Yep.
the bone gets taken away when it becomes infected with a periodontal bacteria. And so really making sure that you don't have or don't get periodontal disease is one way to prevent the recession of gums.
Gotcha. That makes sense. Okay. Wow, these have been wonderful tips and just such a great discussion. Thank you so much. there, so you made a little bit reference to resources, like for affordable dental care, right? In the sense of
Mhm.
going to schools, those dental schools. But I guess are there other resources? Because obviously dental care is very expensive, especially when we're no longer private insurance and we're Medicare eligible. So, what resources are available for affordable dental care?
Yeah, sure. So, Courtney, I'm sure you know the AARP has several dental insurance plans for individuals and family coverage.
Mhm.
So, individuals can look into that. Um, yeah, Medicare Advantage plans increasingly include a dental benefit. And that their thought is that it could reduce long-term medical expenses. So you could
Mhm.
check into your own Medicare plan to see if it's an Advantage plan and if it includes a dental benefit. As I mentioned, Illinois has 3 dental schools, and it also has about 12 dental hygiene schools. And so you could just kind of look for dental hygiene school in your
Mhm.
area, or you could go to our webpage. We have a listing of those. And that they offer dental care at reduced fees. So dental hygiene schools are going to be limited to, dental cleanings, periodontal treatment, that kind of thing. So 3 dental schools, 12 dental hygiene schools in Illinois. A few of our local health departments also provide oral health services. So check with your local health department. There are a number of community health centers in Illinois, our FQHCs, that provide affordable dental care or have a sliding fee scale that is based on income. There have been federal, at the national level, talks about including a
Mhm.
dental benefit in Medicare Part B.
Mhm.
And healthcare leaders have performed extensive research to develop a benefit plan. And several studies have shown that a preventive dental care can actually have cost savings, both
Mhm.
for the individual and for the healthcare system. But work continues to evolve on this, and individuals and states can play a role through public
Mhm.
education and advocacy to ensure that people who had private insurance during their working time and now retired don't have an oral health benefit. And so that's one other thing that's going on across the nation. Hopefully that at some point we get a dental benefit that includes all
Yep.
ages. Yeah.
Yes, AARP is very supportive of that, and continues to work on that issue in Washington, as well as really just working on advocacy, health, oral
Mhm.
health advocacy within our state legislatures as well. So, yeah, completely believe in that. I want to thank everyone for all their questions. We have so many coming in, and we don't have enough time. So I can tell you that there's more health huddles that are in the works, including I think we need to continue to explore our oral health and this discussion and kind of go even in deeper. Deeper context so we can get all these questions answered. We'll do our best in the chats to help answer some of the questions. So can't thank everybody enough for all of these wonderful questions. And I promise there'll be more health huddles in the future. So join us all the time, right? Because just keep those questions coming, and that will keep us all coming back to you because this obviously means a lot and we appreciate that. So I mean, we have these health huddles for 30 minutes, and I swear I think we should go longer sometimes, but want to be cognizant and respectful to everyone's time. So just want to extend a heartfelt gratitude to our esteemed guest, Dr. Mona Von Kagan, for sharing her expertise and insights with us. So are any closing or last words you'd like to
Yes.
share with everybody?
Yes. I would just say it's never too late to improve your health. And by doing so, you're investing in yourself. Take care of your mouth, and the rest of your body will thank you.
I love that. That's perfect. Perfect way to end. Thank you again, Dr. Mona Von Kagan. Your resources and your information on oral health, really, it's incredible. So thank you so much for your expertise. For more information and more resources on oral health specifically, you can go to aarp.org or you can go to dph.illinois, and it's spelled out, so dph.illinois.gov, G-O-V, for more information and more resources. Now, as we conclude our session, I promise you that we'll be bringing more health huddles, in particular on this topic. But as Dr. Mona said, please remember taking care of your teeth is an investment in your overall well-being. Regular dental checkups, proper hygiene, balanced diet all contribute to healthier smiles and, of course, a happier you. So thank you for joining us today, and let's keep those smiles shining. So thank you once again. Thank you all for joining us. We look forward to continuing our mission of supporting older adults, caregivers, and the entire aging community in Illinois and across the U.S. Have a wonderful day, and this concludes our virtual event. Be well, everyone.
Bye-bye.